I have a question here, and this usually works. When I give a talk, I ask the audience a question at first, and it may not work in this room, but if you can put aside what you already know and pretend you know nothing about health insurance right now when I ask this question, how many here would rather have, let's pretend that money is no object whatsoever, how many of you would rather have a $1,000 deductible on your health insurance plan versus a $5,000 deductible? Who wants a $1,000 deductible? Let's say that money's no object. Come on, just be honest. Okay. Now, who would rather have a $5,000 deductible? Okay. So let's say you're going to Vegas next week. And again, money is no object. Which would you rather have in your pocket, $1,000 or $5,000? You'd be amazed at the responses that I get with people when I give that question out at just regular meetings with non-physicians who are not jaded. And I like to point out that that is the hypocrisy that we all have, that Americans have towards their health insurance plans these days. And this is really, what I'm here to talk about today is what I call the big myth of healthcare. And it's comprised of several different elements, one of which I just illustrated, that people think that health insurance is a good thing to have. And it is a good thing to have. I want to be clear and say that I believe in health insurance. I have health insurance. I recommend people have health insurance, but it's really smart to have. It's dumb the way we expect it to work, the way Americans expect it to work these days. So what I like to do is bust this big myth of healthcare, and I do it by, I got discovered by Dr. Orient on Twitter because I got fed up about a year ago with trying to educate folks, and so I decided to use my sense of humor to do this and to point out the absurdity of how we view health insurance and healthcare in this country, and it's working. I mean, I'm getting a lot of followers, I'm getting a lot of good responses, and it's working with my patients too. And I think that the future of what we're all trying to do in this room is cash pay, is a direct patient care approach where there's no third-party involvement, no third-party intervention. And the question becomes how best to do that. I don't think there's anybody here that I've heard talk so far, ask a question, or just sitting here, who would not rather have no third parties involved in their practice. The question is, how do you do that? How do you get there? And the big fear is that it's not going to succeed. I can tell you, after running a direct patient care for 5 years of practice, it's pretty tough. But who you're trying to convince, who you're trying to sell your services to, more or less, are the patients. And doing that, converting those patients, getting their mindsets into the right mindset, doesn't require a whole lot, but you've got to give it the right approach, I think. And you have to come down to their level and really explain to them what's involved in their decision making, because they don't understand macro, they don't understand par versus non-par participation. All they want is to have good service, and I like to say there's three things missing from healthcare these days. That is affordability, customer service, and consumer choice. You can go to your grocery store and have a pick of 60 different toothpastes. It takes me half an hour to find my toothpaste these days, but I have almost no consumer choice when it comes to my healthcare decisions. Well, in the direct patient care environment, not only do you have that choice, but I encourage it with my patients as well. So convincing folks of these three things is a bit of a challenge. I can attest to that, and it's definitely something that, you know, it's a fear factor. But if you really take the right approach, I think you can do it. So I try to use humor in my approach. I like to point out things like the absurdity that, for instance, you wouldn't let a health insurance company pick what goes on your pizza tonight. Anybody in the room would allow that? But I know most people let a health insurance company pick their physicians for them. And when you think about this, when you step outside that box, as many of you already have, and I'm probably not telling you anything, when you step outside that box and you look back, it becomes quickly absurd what's going on or what has happened to healthcare and the whole healthcare and the physician-patient relationship over the past 40 or 50 years or so. I like to illustrate this by, in the introduction of one of my books, I discuss this story in detail. It's a true story. I was at a concert a few years ago, and this couple sitting next to me said, "Well, what do you do for a living?" It was the intermission. I said, "Well, I'm a doctor." That is a conversation starter, as I'm sure all of you in the room are aware. And the woman looks at me and she goes, "What kind of doctor are you?" And I said, "Well, I have just a general primary care practice, but hey, I don't accept health insurance." And the lady looks at me just dumbfounded and she says, "Wow, that is genius. You know, you're a genius." And I looked at her and I said, "You know, I don't consider my business model really to be genius. I mean, I look at it as being like every other business in the U.S. I mean, I provide a service and I get paid for doing it. So what's genius about that?" But let me tell you what's genius, ma'am. What's genius is the fact that you and millions of people like you think that I'm a genius. Now that is genius. And just like that, I mean, her eyes opened, both her and her husband's eyes opened. You could see as the big myth of healthcare fell away from their faces, and they finally understood that for decades they've been had by this situation that exists where they think that the only way they can access health care is through health insurance. And that is the big myth of healthcare. That's what I want to talk about today in busting that. The bottom line is that every day in the news we're bombarded with the idea, and I heard somebody mention it earlier about the rising costs of healthcare. Healthcare is not expensive. It's not the costs of healthcare that are outrageous. It's the charges. When I can provide a nebulized breathing treatment for $15 in my DPC clinic, and yet you go to an ER or a hospital and you get charged $64 for the same dose of albuterol, and the question becomes, how much does the albuterol cost? And when I point this out to audiences, I say, it's about a nickel a dose, because I can get 75 of these for $4 at Sam's, and so can you. I mean, so can anybody on a prescription. When I point this out to people that healthcare really isn't costly to provide, it's just chargely, if such a word really exists. I may have just made it up. But the bottom line is people's eyes are open. They understand that, you know, you're bringing value to them. You're pointing out that, hey, listen, don't believe what you hear in the media every day. Another one of my pet peeves, if you follow me on Twitter, you'll see this virtually every day. I scream about the fact that the press, the pundits, the politicians, all of these people are priests for the big myth of healthcare. And what they do is they preach this myth that healthcare equals health insurance, and vice versa, that health insurance equals healthcare. Well, I used to be a health insurance agent. Just for grins, a few years ago, I spent 4 hours studying. Any health insurance agents in the room? Good, let's talk about them. So I spent 4 hours studying, and I passed the test. Quite a different thing from the board exam, which very little of my board exam had anything to do with emergency medicine, I assure you. So the bottom line is that we have to educate people, and the way to do it is just by using a common sense approach. It's something you already know. It's something that you're already well versed in. But I hear all the time on Twitter about how doctors really were the reason why we're in this whole bag that we are now. And that if the doctors hadn't given in to the insurance companies back in the 70s and 80s, then we wouldn't be here today. Anybody share that idea? Anybody live through that idea? I spoke with one gentleman who was there. Now, I wasn't there. I'm 49, so that was a generation before me. But I would like to submit to you that the health insurance industry is what did this. The physicians back then really didn't have a choice. I mean, if you're a doctor operating a clinic back in the 70s or the 80s when managed care came along, and I write about it in my book as well, that you hear, or I can just imagine the conversations that must have occurred when the managed care reps would come around and say, now, doctor, our patients pay $5 to go to the network doctors in our network. How much are you trying to charge them again? I mean, that was it. If you're faced with that situation, if you were a physician back then and managed care, the managed care was the new kid in town, you had to play along or you died. You did not get business. This illustrated still to this day in 2018 by the fact that everybody here in this room is fearful of getting off the health insurance racket. Not everybody, but most of you have some concerns. And you should. Those are legitimate concerns. Because the health insurance industry and the government with Medicare and Medicaid, they have taken over the minds of patients. And I want this to be clear in everyone's minds as well, is that if you want to take back healthcare, and we all do, then we have to get with the patients. We can organize all we want to, and we should, and I believe that AAPS is the best organization to accomplish that through. We can educate each other to become disciples, to go out and preach against the big myth of healthcare, against the idea that health insurance provides you with access to healthcare, or that it provides you with one of the things I saw lately that's brilliant. Never underestimate the genius of the health insurance industry, okay? They're genius. They thought this through decades ago. But one of the things, you know, when you look at an EOB, an explanation of benefits, it used to say allowed amount or the negotiated rate. What does it say these days? Anybody got a guess? Anybody seen one of these recently? Where it says member rate. Now, that sounds like a green stamp club. It sounds like a AAA discount. Like the patients are getting some form of a discount because they go through their member rate. They have health insurance that pays for this. Well, anybody that's got a $2,000 or a $3,000 or a $5,000 deductible, I like to point out to them, you're a consumer. It's not up to the health insurance industry anymore. In fact, one of my tweets is that if you have a $10,000 deductible on your health insurance plan, then your HMO doesn't get to say no to your MRI anymore. You need to just go ahead and ask your doctor to order that and pay cash for it. In the Dallas-Fort Worth area, I can get my patients MRIs at a local imaging center, a non-hospital affiliated imaging center, for $350. Anybody got that? Anybody beat that? Anybody even close? $400 or $500 for an MRI across the country? Yeah. Yeah. So you can find these negotiated rates. You can get people discounts. When it comes to lab work, what I do is I've negotiated with Quest Diagnostics. I have an account with Quest Diagnostics. They directly bill me. They charge me $1 for a CBC. I don't even bother doing labs in my office. We just draw blood. We send it out. I charge the patient $20. They're happy. I'm happy. I'm making a little money. Quest is happy. I'm providing them with business. What's not to love about that? The patients just pay for it directly. So it's not the costs of healthcare that are outrageous, it's the charges. And unfortunately, in more and more of a corporate setting, you're not setting those charges anymore. Another one of my tweets is that the patient comes in and says, do you have any idea how much you charge for an office visit? And the doctor's like, actually, no. How much do I charge for an office visit? I just get paid by the hour. I get paid a salary. So these are things that we need to educate patients about, and we need to really get out there and bust up the big myth of healthcare, because if we don't, then we're going to move more and more towards single payer. But to me, the game changer, the thing that has absolutely made the difference for us in this room and for the nation as a whole, is high deductibles. This is the way that the health insurance company has shot themselves, the industry has shot themselves in the foot. Because if I could make a rather crude analogy, by the way, I call health insurance, I say that America has an addiction to health insurance, and they do. They clearly do. Anytime people are, let me say this, another little joke. How do you turn a $100 doctor visit into a $20 copay? You buy an $1,800 a month health insurance plan. Works every time. So people are addicted to health insurance, and they'll be willing to pay whatever. And another one of my tweets is, why does your health insurance company charge you $1,700 a month for your health insurance plan? Because you keep paying them $1,700 a month. I mean, people are doing this. Now, I'm not saying there's a lot of options for that right now. But clearly, when health insurance companies rival, or when health insurance premiums rival mortgages, it's equivalent to drugs, to dope, let's say. And health insurance companies, health insurance industry is the largest drug dealer in the US right now, because they have everybody addicted to their product. Not everybody, but everybody except the people in this room addicted to their product. And when people are addicted to what you're selling, you can charge whatever you want to for it. And that's why the health insurance premiums now rival mortgages. But if you're really smart, if you're a really savvy drug dealer, you start making your profits even higher by cutting the drugs. You cut the dope. Instead of putting 1 kilogram of cocaine or heroin, again, I apologize about the crude analogy, but it works. Instead of selling 1 kilogram of drugs, you cut it with flour or baking soda or sugar or whatever your favorite adulterant is. Now you've got 2 or 3 kilos. The addicts still buy it. They grumble a lot, but they're addicted to it, so they're going to purchase it. Anybody in the room got an idea how the health insurance industry accomplished this, how they cut their product? Anybody? Deductibles, high deductibles. Yeah, high deductibles are the key. Nowadays, the health insurance industry sits astride the best of both worlds. They've got people paying them thousands of dollars a year to have something that they almost never get to use anymore. And this is quite a bit different from the days of old. Another thing I want to point out, and again, I hope I educate some folks today. I hope this isn't just me ranting, but the bottom line is on Twitter I get this blowback sometimes about how we have now a very expensive prepaid health care system. Well, I disagree with that. I disagree with that wholeheartedly. When I was born in 1968, I still have the birth receipt. I should have made a slideshow, and I apologize about not doing that, but I have a slide, I have an image that I put on Twitter all the time. It's my birth receipt. It literally is the receipt for my birth from 1968. Now, it was an uncomplicated birth, but back then they kept everybody in the hospital, so my mother and I spent 6 days in the hospital. The total bill was $406.80. The delivery fee was $50 from the hospital. So the bottom line is that my father's health insurance plan back then paid for all of it but $10.75. Now, I can't imagine the last time I wrote a check for $10.75, but hey, he said I was worth every penny. So The bottom line is that this $406.80, of that, 97% was paid by the health insurance company. That's not insurance. That is prepaid health care. You're paying a premium for somebody else to take all the drudgery off of whatever your medical bills are going to be, and boy, did Americans fall for that. Way back when, in the 50s and 60s, they got used to that, and I would submit, again, I'm not a conspiracy theorist, okay? But I would submit that that was the health insurance industry's goal all along, was to get everyone hooked on what they were selling, and then they can start manipulating it. Took them a while to do, but they've done a beautiful job of it. I hope you agree. So again, the high deductibles are the game changer for everyone. But what it means now is that patients with these high deductibles, guess what? They got to pay for their health care. And so to me, it makes a lot more sense for them just to pay directly for their health care, especially if you can bring them the health care with transparency and pricing, etc. So what we don't have today, we don't have a prepaid healthcare system. Now we have a health insurance system. I mean, anybody here use your car insurance in the last year? Last 5 years? A couple of examples. These are my tweets that I put out. Again, follow me. I think you'll laugh as much as I do when I put them out there. But these are two true stories. Now, I run a DPC practice. I don't accept any health insurance. None. Zero. Health insurance to me is alien. We don't even know how to bill patients. So I'm about as out of network as you can get. But this presents some interesting behavior at my reception desk from time to time, one of which was when a woman came in and she said, you know, my receptionist, really, this really happened. My receptionist said, I love your purse. That's a really nice, you know, Coach or whatever purse. And the patient said, oh yeah, I got it on sale for only $400 for the purse. Do you take Aetna, by the way? I need a flu shot. So that really happened. I mean, that whole attitude about, you know, I need Aetna to cover my flu shot, this $20 thing, but I'm going to spend $400 on a purse. That's where we are. That's the mindset we're up against as physicians. Another example that happened, again, this is a true story, I swear. Guy came in, he wanted to be seen. We told him this is back when I did urgent care for just pricing. I charged $99 for the visit. $99 for the visit. He says, you want to charge me $99 and you don't take health insurance? I'm just going to go to the ER. I mean, that's crazy. Well, so we always, as part of our spiel, we would try to convince the patients to say we would look up their health insurance benefits so we could give them an idea that if you haven't met your deductible, hey, it makes sense for you to pay the $99. If you've met your deductible, then you probably should, you know, unless you want to pay the $99, then, you know. So we're trying to be honest here with the patients, but my receptionist looked at this guy and she said, sir, your ER copay is $250 versus $99. He goes, yeah, well, at least they take my health insurance, as he stormed out the door. That's a true story. True story. This really happened. And then the last example was when I told a patient, and I had her in my exam room, and I said, I want to do an ultrasound and see what's going on. I forget if it was her gallbladder or whatever. And I said, now the cost of doing this ultrasound over here at this imaging center is $150 flat. That's it. Radiology fee, no surprises. You just pay them $150, you're done. But you have to tell them you don't have health insurance. She said, well, how much would it be with my health insurance? And I said, a lot more than $150. But I mean, it'd probably be on the order of $1,000, maybe $1,500. I have no idea because the price isn't listed. She looked at me and she said, I think I would rather pay the $1,500 and get credit toward my deductible. That's crazy. I mean, but this is the mindset that we're up against with Americans, with the average ordinary patients. They're still stuck on the health insurance, or one of my other favorite excuses is, well, I pay so much for my health insurance, I just got to squeeze every last drop out of it. And it's like, well, okay, well, you're not. I mean, you're going to hit your $10,000 deductible? Great. What else are you going to do this year that's worthwhile? So the bottom line is educating patients is very tough. I will admit that, but as I've done this over the past 5 years, I've noticed a change. And that is that people are much more amenable to this, whether it's Obamacare, whether it's the what have you. And I maintain that these health insurance premiums and deductibles were going up well before Obamacare. That definitely injected some steroids into it, but they were going up well before that. And this was part of the health insurance industry's plan all along, was to get everyone hooked and then raise up their prices. Some shocking statistics, okay, just for fun. How much, and I looked this up on Wikipedia. Anybody here can do this if you believe Wikipedia. They've got these corporate snapshots if you look up these health insurance companies. They've got corporate revenue. Now, before I get started, let me say this. I know this isn't profit, and I'm not a business guy. I've never taken one business course, and sometimes it shows. I'm very good at subtraction. You can ask my accountant. She'll tell you. But the bottom line is that when I look up these corporations, I looked up McDonald's. Now, McDonald's is everywhere. I know of a few places where there's 2 or 3 McDonald's in a 1-mile radius of each other. Their total 2016 revenue, corporate revenue, was $26 billion, with a billion. Now, Aetna's 2016 revenue was $66 billion, almost 3 times what McDonald's was running. Microsoft, we have a fan here in Microsoft today. I'm an Apple guy. But Microsoft's 2016 revenue was $67 billion, just 1 more billion than Aetna. But take a look, take a guess at how much United Healthcare's revenue was. $187 billion for that same year. Now, I understand you can't compare apples and oranges, et cetera, but when you look at these companies that are generating hundreds of billions of dollars selling something that used to be sold door to door, it really gets mind-boggling how deeply ingrained into the American mindset the health insurance industry is, and the kind of battle that we all face. But again, I'll bring it back to the deductibles. If you can speak in those terms where your patients understand what you're talking about and they get it, and they do, they're very close to getting it. They understand that I'm paying $800 a month to have this $10,000 deductible. What does it get me? And I'm like, well, that and a couple of bucks will get you a bag of chips. I mean, come on. So the bottom line is that we have to start educating people. We have to start pulling them in. Get them to educate their peers. If you live in a suburb or a small town or anything, host a get-together, have a rally, have a town hall meeting, advertise it. Find some co-sponsors like a local independent pharmacy I've found has been very good. Local imaging centers that are non-hospital based. You can find sponsors to help you put these things on and rent a facility like this and do some marketing and advertising for it just to promote your practice and promote the idea that, you know, health insurance isn't all that it's cracked up to be, and this is why people need to start coming in and seeing you and just paying you. Again, it's like every other business in the U.S. I mean, it's one of those things where, and when you pull aside the curtain and you get a peek at what Oz really looks like, everybody that I've talked to, everybody I've shared this with is amazed. They're amazed at how they were fooled and how they were bamboozled. Take us back to that couple that I mentioned. They had no idea that they had been so just intellectually strangled for decades. And it didn't take much to convince them otherwise. Really, all it took was just a couple of clever lines, and they got it. They got it entirely. So can other people. They do. They're starving for this information. One other thing I would promote, or I would put out there, is that employers are a great resource for you to go to as well. How much does Starbucks spend on health insurance these days? More than they spend on coffee. And that's a big deal. Employers, usually their second line item expenses for health benefits, medical benefits, whatever we want to call it, health insurance stuff. So employers are a great resource for you to go to. Now, I would caution against some of what I heard earlier about making deals with employers and making deals with the state or Medicaid, because I had a gentleman who follows me on Twitter call me last week out of the blue, and he said, hey, listen, he's in Texas as well. He said, look, there's a startup company in Austin, I won't name them, and they're starting up these DPC practices everywhere, and we'd like you to be our Dallas-Fort Worth guy. And I said, okay, so tell me what the deal is. He said, well, they go to employers and they hook them up with health insurance benefits. So it's a one-stop shop. And then they negotiate these DPC rates. So you'd be paid $90 a month per member. And so it's a PMPM. Remember these things? Capitation. So it's $90 per month. And I talked to him on the phone and I said, no, wait a second. Can I be fired? He said, well, of course. I said, can this company restrict my access to these patients at any time? He said, well, yeah, of course. I said, well, what if I take on what if I take on an employee, a print shop or something that's got 12 employees in it? But one of them is a real bear, and we're talking about DPC. I offer free consultations. They pay me. I do mine a little differently. I charge an annual fee, and then basically I just provide 24/7 coverage for them. There's no charge for the visits. Well, that can be abused, and I've had to let go of some patients who choose to abuse it. So if you get a patient in this 12-member employer group who's a real problem, are you jeopardizing your relationship with the other 11 patients if you let that patient go, if you let that person go and say, I'm sorry, I can't take care of you? These are the questions that I think you should ask when you're talking about dealing with employers or with large groups. Because anybody, and the guy who called me, the gentleman who called me, he said it best. He goes, well, how's this different from insurance now, how it's run? And I was like, it isn't. Not at all. And in fact, the insurance company can help dictate what I do for my patients. I don't want some employer or anybody else sticking their nose in where it doesn't belong either. So I do court employers. We go to small businesses. Let me ask the group a question. Even before Obamacare, even after Obamacare passed, this statistic still holds true. What do about 90% of people who don't have health insurance also have in common? They what? No, they work. They have jobs. They're productive. Now, it may not be, it may be working at Taco Bell, but there's a lot of small business owners out there, and especially in my area where I practice, there's a lot of small businesses around, and we court those, but we don't structure it so that the employer's paying us directly. The employer can pay their employee or what have you. I mean, that's up to them to do, but to avoid the ERISA stuff that Dr. Eskew mentioned, to avoid that stuff, I don't accept payment from employers directly. It's just me and the patients. And that's the way it has been. That's the way it should be. And I hope that's the way you can all find for your futures as well. Thank you very much.